Have you heard the word autism before? What do you know about autism? Do you know someone who is autistic? What do you do when you learn that your child is autistic? My name is Peter Nawa, and you are listening to Silence Interrupted. Every parent wants a healthy child, one who is able to go to school, play with friends, and have a fulfilling life. But sometimes what parents wish for doesn't always happen due to one reason or another. One of those reasons is a condition called autism. Autism, or autism spectrum disorder, refers to a range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and non-verbal communication, as well as by unique strengths and differences. There is not one autism, but many types, caused by different combinations of genetic and environmental influences. To get an understanding of mental illness in children, which is often a topic that is rarely discussed, I talked to Dr. Ravi Paul, who is a consultant psychiatrist at the University Teaching Hospital and Silver Lining Healthcare. He is also the head at the Department of Psychiatry, School of Medicine at the University of Zambia. Later in the episode, I speak to Rodney, whose daughter is autistic. I'd first of all like to talk about an aspect of mental health that's often not discussed, and that's children. Why do you think when discussions of mental health come up, children are rarely left out? It's mainly adults who are looked at.
Yeah, that's a very good question, and you're right that that segment, that age group is usually left out. The reason being, probably we don't have a mental health unit dedicated only to children or adolescents in this country. So if a child has a mental health issue, they would go to UTH and be admitted with a pediatrics unit. And we as psychiatrists would look into that problem, but we won't segregate them from the rest of the general patients. So therefore, we are not able to identify what are the numbers, what percentage of children would come across mental health issues. There are many children who are referred to us at Clinic 6 UTH, and we dedicate 1 day a week to see children with mental health problems only. But I don't think that is enough, because just one clinic cannot cater for the whole country.
So are there illnesses that adults would have similar to one that children would have, or are there certain illnesses that are just specific to children?
Well, some of the illnesses, they're cross-match. They're there in adults as well as in children, like depression, like drug abuse problems, which are increasing now in child and adolescent population as well. But there are some others which are more specific to children, like attention deficit hyperactivity disorder, children which are very hyperactive, or you can say autism, which is identified in childhood, or mental retardation is identified in childhood and then can go on into adults. Other problems like bedwetting, usually it is a childhood problem, phobias, and then as they grow, they're able to overcome that, or other anxiety disorders, separation anxiety. Yeah, so, but others, they are usually carried forward into adulthood.
Let's take, for instance, an illness like autism. If a child perhaps never goes to school, and maybe parents may just think that this child is just reserved, doesn't like to play. How easy is it for parents to identify or get worried or concerned that this might actually be a mental health problem? Are there any things that parents should look out for to determine whether I need to seek medical attention for my child?
Yeah, there is a serious lack of awareness amongst the parents, as well as amongst the teachers, schools that they go to. So you see that if a child is not disruptive, is not aggressive or violent, then they may just leave him, thinking that he is developing slowly or he's a quiet child, not thinking that he's not reciprocating emotionally. Socially, he's not inept, he's not so good, he does not maintain an eye contact, and maybe sometimes he hasn't developed speech. He hasn't developed any communication skills. So for them, they believe that, yeah, he's a slow learner. Maybe he'll grow up and then he'll be fine. And the next thing is looking into if he's possessed by some evil spirits or there are some other religious or spiritual things attached. So they would try to dwell into that. So it may be very late when they would actually identify that this is a problem. And then from there onwards, once the diagnosis is clear to them, it is very difficult for them to accept it. Why my child, has this issue, and then they believe that he will be 100% fine. He will be developing normally. He will be good in academics. That puts a lot of pressure on the child now because he's not able to perform. He's not able to learn. So he gets frustrated. The parents gets frustrated, and the frustration goes back to the child again. So it really, weighs heavily on the child's development. If parents are educated on those lines, and if teachers are trained enough to identify autism very early, then there may be certain skills that they can learn early in their life. There may be certain help which can be available to them before it is too late.
Should then schools be doing much more training in identifying these mental health issues, so they can be easily reported because they spend more time with the children in schools and able to pick up these?
Definitely, the teachers who deal with children very early age, they should be trained in identifying such issues. A shy child, a child who does not mix up easily, or an aggressive and violent child, or a child who has not developed any speech or any communication skill, who's not able to even say his needs by gestures or verbally. So if they are able to pick that up, then it will be very helpful. They can communicate it with the parents, and they can look into what is the problem. Now, all the government schools in Zambia have special needs teachers, so they are trained in this already. So just for them to be more oriented to such issues, maybe all the children which are admitted at basic level and at kindergarten or grade 1, they should go through a screening through these special needs teachers because they are more adept at identifying those problems.
Are there any mental health illnesses that children would have that will probably stay with them for until life and just need to be managed or maybe put on medication for?
Yeah, like we discussed about autism, mental retardation stays with them for the rest of their life. So once we make that diagnosis, then we tell the parents how capable your child could be in terms of academic achievements. And it is important for them to know what are the child's strengths so that they can focus on that rather than pushing them back to school and go and learn scholastic skills, meaning academic skills, which a child will have a limited capacity to. And they can push them into learning other life skills, like taking care of themselves, how to put on their clothes. They could be toilet trained. Slowly they can learn how to make a cup of tea for them, maybe how to cook food for them, or maybe they can go to certain vocational training schools where they can learn certain vocation and they can be self-sufficient as they grow up. There are other illnesses like schizophrenia. If it strikes early, it can stay with the child for the rest of their life. Mood disorders, they're episodic. They come and they go, they come and they go. But obviously, once a diagnosis is made, it is for life. Certain phobias, certain anxiety disorders, like obsessive compulsive disorder, where a child would want to wash hands frequently, or they believe that if they don't follow a ritual, then something bad will happen to their siblings or to their parents, or they want things to be aligned in a certain order. So those disorders, they go on into adulthood, and we need to intervene early to put a stop at the progress of the condition. Otherwise, they keep on suffering, and it jeopardizes their development.
And you work for
you also work for UTH, University Teaching Hospital. So for a disease like autism, someone who's probably gone to school, it's easier to understand and explain it to them and they'll get it. Now in my head, I'm thinking, how about somebody from a rural area, from a village, and they tell them your child has autism? How would you break it down? Or how do you think would be the best way to break it down to get to understand that, okay, this is what he's been diagnosed with, and this might need to be managed?
So, in that regard, the Ministry of Health recruited MHAs, which are medical health assistants. So, they are at the grassroots level and they work in the communities. In the remotest area, you will find a health assistant available. So, we were planning to run a project where we can train them in also identifying mental health problems like autism. It is not difficult to identify autism. It's just a few questions which they can ask the parents or they can observe in the child when a diagnosis is made. So once they have made a diagnosis, then they can refer that child to a higher center like a primary health center, where a psychiatric nurse or a clinical officer in psychiatry can further explain to the parents in a better way. Okay, and initially it should be told that it does not affect their life. The child will live a normal life. Okay, so they may have certain skills which they are very good at. So we just need to identify that. If you are able to identify, then we push the child to develop more in that area. Okay, and also to tell them that, yeah, he may not be as social, he may not be as active in his academics, he may be very good in sports. So once the parents are told about a realistic situation, it's very important to tell them what they can expect from their child. Many times we may play diplomatically and don't disclose the actual condition, and they keep on expecting the child to behave normally, to act like other children, whereas he or she is not. So that may not be a very good thing. So it's important for them to understand it very early, and so that they can put their energy and resources in a proper direction. So they may be thinking, no, we can put our child in a better school, whereas a special school will be a more appropriate place for the child to go. They keep changing schools or keep changing teachers, or they would want child to be homeschooled, bring in tutors at home. But all that is not going to help, because his maximum academic achievement will go up to maybe grade 4 or grade 6 and not beyond that. So that frustrates them a lot. But if they know that, yes, our child has other areas of expertise where if we push him in and he can develop more skills in that area, he could be self-sufficient.
So for families that do not have the resources, financial resources, to either take their child to maybe get specialist treatment from a private institution, do our government institutions provide that support for parents? Or are there enough institutions that can provide support for parents who have children with mental health challenges?
If you talk about autism and mental retardation, I think the government has provided enough support in terms of training special needs teachers, and I'm sure they are there at each and every school in the country. So if a child will need any further treatment, like they have to be hospitalized or they have physical disability along with a mental health problem, they have, say, cerebral palsy, which would mean some part of their body is having a spasm, they can't move it, or they are crippled. So in such conditions, they will need a medical care, a proper medical care. We do not have enough institutes across the country where such children can be attended to, or special equipments can be made for them to be mobile, or they can sit on their own or walk on their own. So yeah, in that area we are lacking. And also to have a specialist mental health institute, like we have Janama for adults, we should have one institute for children and adolescents as well, where their problems can be dealt with easily. I'm sure every parent would be scared to send their child to Janama because of the various issues, and especially the stigma attached to the place. and also the trauma that the child will go through once they see other patients who are suffering from various chronic mental health conditions. So I think we need an attachment to UTH and other provincial hospitals where children can be kept and observed, diagnosed, and then once they're better, they can be sent back to the society.
So at the moment, Child Number does not admit children, it is only UTH?
It's only UTH which admits, and that too in the pediatrics wing.
Coming up, I speak to Rodney Katungu, whose daughter is autistic. In this first part, he shares his story on how he found out that his daughter had autism.
On a Facebook article on the 3rd of April, you wrote an article and the first sentence was, "My daughter closes her ears with both palms, pressing them hard on the ears, and screams. We calm her down." Would you mind telling us what this incident was about?
Well, I think it's not just one-off incidents. Many times I have seen my daughter do that. And really, at first we used to get surprised why she has to press her palms right hard on both ears. And at first we used to stop her and you'd shout and say, "No, stop that." But later on, when we understood her condition, we knew that once she does that, she may have had sensory overload. It means either some noise has disturbed her or she's not happy about something or some kind of noise somewhere. So each time she does that, we know that something is wrong. And the best thing we could do is to calm her down. And so I thought that we could put a piece, because I know that, it's strange to see a child press so hard. And you could tell that something is wrong, something is not right. Yeah, so that's exactly what it meant.
And what condition is that?
That is just one of the symptoms of a condition called autism. And I think that I learned about it when I went to the workshop, where we were taught that some of the elements of that particular conditions, you would find that somebody presses their hands very hard in ears and then it means something has happened. And that's what we learned, that sense of overload. It means some noise has actually disturbed her. So I think that's what I would say.
Okay. And how old is your daughter?
My daughter is 4 years now, and this year by November she'll be turning 5.
Okay. So how did you first notice that you may need to seek medical attention for your daughter? What signs did you have?
Well, actually it was by coincidence, because my daughter had an earlier condition called laryngomalacia. So she had problems with the airway, and because there was some kind of malfunction, and then I'll put it in a layman's language what the condition was. We observed that each time she got extremely excited, or not really excited, or she's crying, she would have extreme problems in terms of breathing. And so it means that she had problems in the airway, and they call it laryngomalacia. So it more or less like collapses, the airway collapses. And then each time she has, for instance, flu, it gets worse. And sometimes what you observe is the sound. The sound becomes terrible because it really blocks the airway. So there's squeaky sounds that come from her. And so we had to deal with that condition, and we began to notice when she was about 4 months, but the diagnosis about that condition was about six months. And during that period of time, we only knew that that's a condition she had. And I think that was even much more a heavier condition on us, and being the firstborn child. And after the diagnosis, we kept on going to the hospital, and we were taught that as she grows, the airway begins to mature, or what holds the airway begins to mature, this problem will go up. And at first we couldn't believe it, but finally it began to disappear when she was about almost 3 years. And it is during that particular time when she was being discharged of that condition that we were made to go through another kind of assessment. And after that assessment, we just took it like any other review on that particular condition. What we then learned after that, we were told that she should be coming for some kind of therapy. At that point, we didn't really know exactly that she had a different condition because we were not well informed at the hospital. So we started taking her for that therapy, and in our mind, we were very convinced we were going there for speech therapy because she had some difficulties in terms of speech. So we were extremely convinced that she was going for speech therapy. After quite a number of months, we received a call that parents that have children going for therapy should actually attend a workshop. And it was during this particular workshop, I wasn't supposed to go. And by then, my wife used to take my kid for therapy. And whatever happened, I had to go for that workshop. I didn't really want to go. I went because my wife was also extremely busy. So I said, well, I need to know what this is all about. And I went there. I was surprised in the meeting to learn that the kid was autistic. And whatever they described, what their condition was, is what we were going through at home. But we didn't know because we took it that, wow, because she's coming from this particular condition, so she's maybe slow in learning this or doing that. When I came back, I was extremely shocked. And so I asked my wife why we were taking her for therapy. She said, speech therapy. Well, I got the file and began to check and saw that was a diagnosis or an assessment was done, and it was written that she's autistic, was mild autistic or something like that. And so I looked and it was written. So I was surprised why we were not really well informed that the kid has got this and we're taking it into this group because of obesity. But I could remember that in one of the interactions, it says, oh, well, she may have a condition or something like that. So we tried to help her in terms of speech. So we took speech as the primary reason why we were taking her for therapy.
So before that meeting, no one told you that your daughter had autism?
No.
And you didn't even know?
No.
Was this a government or private institution?
It was a government institution.
Government institution.
Yes.
But it was written on the file that she did have mild autism.
Yeah, it was written that she had, they had put, because they call it spectrum, autistic spectrum disorder or something like that. And I think maybe either we didn't pay attention or we were not well told about the extent of the condition. So it's one thing to be told, well, yeah, she's got just one of those things. And then it took me a bother to go back in the file and check, which is really rare because sometimes those files, you may not have access to them.
Yes.
But I insisted during one of those meetings to see where the assessment and what kind of form was done. And indeed, it was confirmed that they had enshrined that she was autistic or she had that particular condition on the spectrum itself.
So how did you and your wife take the news when you were finally told or it confirmed that your daughter had autism?
Well, for me, who had learned what it was, I had no choice but to accept. It was a shock. It was also trying to reflect that, wow, this kid has had this condition, and now there's another condition that is coming that needs us to be extremely ready. I went back home to tell my wife about that particular condition in detail, what happens and all that kind of stuff. It was a touching moment because here's a kid that has grown up literally in a hospital every week trying to deal with one particular condition. And just when you think, wow, now she's out of it, as a parent, you want your kid to be like any other kid, to begin to talk. And by then we could hear some voices like which would count not very in clear terms, in terms of 1, 2, daddy or something like that. But this time with this, we felt really somehow not really discouraged, but we said, wow, it's a condition we need to accept. One of the issues that we've been doing with my wife is that if we know about a condition, it's far much more better than not to know, because when you know how to handle it. And being Christians, you prayed about it and say, well, we have to do with it. It's actually mild. And I told my wife, it's mild. It's something that we need to work on, but we must be ready for a time that we do not know when we'll be able or she'll be able to try and form some kind of relationship with us. And now, during that discussion, you would now notice the affirmation to what the condition was. For instance, she couldn't look us straight in the eyes. For instance, she would be flipping up her hands. For example, the same pressing of our ears, so we could see she doesn't want to be with everybody else. And sometimes we would think, wow, this kid has got this different character. She doesn't want to come to daddy or mommy when mommy arrives home. So all those things, when we said she's got autism and said these are some of the elements of what constitute what these are, or to know, I think it just came to a confirmation and we said, wow, so we need to do something about it. Instead of telling the kid, stop doing that, we could find something that would help. So that is when we now knew. But I think that for us and my wife, we didn't have a big problem. I think the trouble now comes with the external people. For instance, the maid who does not understand. And the other challenge is a parent. What would you say autism means in vernacular? You see?
Yeah.
And it's a new thing. It's a new thing to us. I can maybe define it in English or something like that. But even if I did define it to my parents, to her parents, to the grandparents of my kid, will they still understand what autism is? So we took a bother to go and explain to them. And all we can explain about it are just elements of what makes this. But some of them become very funny because they say, but you see, there are a lot of children that will do this. Yes. So it became a challenging moment, not only for us, but for the family, because they knew sometimes we couldn't move because if you move and there were a lot of clouds, you would have the earlier condition would start. And then now we're talking about this other condition. What are we trying to do to the daughter? So I think we had no problem. And we had to accept it and try to do the best for her.
So did you know about autism before your daughter had autism? Had you heard of the word autism?
No, unfortunately, no. And you'll be surprised. We've been doing I do a lot of reading and writing in terms of projects and what we do around. And I'm surprised to learn about it. And it's one of the conditions that I literally had no idea. I had no idea about this particular condition, not until at that particular moment. Neither my wife, nor probably anyone in my family.
Like you have heard, mental health in children is often overlooked, to an extent that there's even no public facility that is dedicated to children in Zambia. Children's mental health also needs to be taken care of as well, because there are many factors that can affect it, such as the loss of a parent, being bullied at school, or a mental health condition. Parents and guardians need to be aware of these things so that they can get the help they need in time. One thing that I would like to emphasize is that mental health is for everyone, children, adolescents, and adults. Rodney had never heard of autism before until he discovered that his daughter had it. The questions that we are to ask is, where is the information? Is there sufficient sensitization on it? And where does a parent who needs help go? I would have to end it here for this first part. In part 2, Rodney will continue to share what he and his wife did to help their daughter, the therapy sessions, his wishes for his daughter, as well as his advice for parents in the same situation. The sound design for this podcast is courtesy of Dubsplat. You can get in touch with me at www.peternawa.com. My Facebook page is Peter W. Nawa, and my Twitter handle is @PeterNawa. I would like to hear your thoughts and opinions on what has been discussed in this episode. Please remember to rate, review, subscribe, and share this podcast. I have been your host, Peter Nawa, and you have been listening to Silence Interrupted.